Looks like we got just about everyone in the room. Good afternoon, everyone. Just welcome you here to our Black Breastfeeding Candid Cross Community panel discussion. My name is Lyann Moore. I'm a certified doula, certified lactation specialist in the community, and I'm also a community organizer with Corewell Health. Excited to have all these wonderful panelists here to discuss lactation today. I am also a mom of three and had the opportunity to nurse all three of them. And I have my co-host here, Bonita, Agee. Give you a chance to introduce yourself, and then our panelists can go on.
Great. Thank you so much, Lyann. Good to be here with everyone today. My name is Bonita Agee, and my pronouns are she, her, hers. I am the education coordinator with Strong Beginnings Healthy Start here, serving Grand Rapids and Kent County. I am a certified lactation counselor, childbirth educator. I am the mother of two beautiful Black daughters who are adults now, which I've had the opportunity to breastfeed them when they were little. And also, I'm happy to say that my daughters were able to breastfeed their children. I have 4 awesome grandchildren, 1 set of twins and 1 13 and 9. So great to be here today to be with you all for this discussion.
I did want to add a couple housekeeping things. If you have any reactions, you can use the reactions in the chat box. If you have questions, put them in the Q&A box, and we'll try to get to those if possible with time. And so next I'll have Rachel go ahead and introduce yourself. You're muted.
Hello, everyone. My name is Rachel Whittington-Cole. My pronouns are she, they. I'm currently a community health worker with the Catholic Charities Healthy Families of America program. I'm a full spectrum doula and certified lactation counselor. I am a mom of 2 beautiful babies who were both breastfed.
Kiara, you can go next.
Good morning, everyone. My name is Kiara Baskin. I use she, her pronouns. I am the program manager of the Day One Doula Collective, which is a community-based doula program in the West Michigan area. I am also a certified lactation counselor and community health worker. And I am the mother of 2, and both of my children were breastfed. Thanks.
Audrianna, Reggie.
Hi, I am Audrianna Thornton, and we have 2 babies, and I can't get you have to get your face in here. We are the parents of 2 beautiful babies. We have a boy and a girl, and I breastfed both babies, and I go by she, her pronouns. Are you gonna introduce yourself?
My name is Reggie. I'm father of the 2 babies. Just kind of supported her through the breastfeeding process. Yeah.
And I'm also, I should say that I am actually actively breastfeeding now. So.
Yeah. All right, Jazz.
My name is Jazz McKinney. I use they, them pronouns. I am the parent to 4 kids, and 2 of them were chest fed by me. And yeah.
And what do you do?
Oh, shit. That's what I do. I'm a parent. In my spare time, I'm the executive director of the Grand Rapids Pride Center. So.
Thanks, Jazz. Rita.
Hi, everyone. I am Rita Little. I am a community health program manager for Corewell Health East. I am also a certified lactation counselor, a certified child passenger safety technician. Also recently got my CHW certification. I am a professor also at Oakland and Wayne State Universities. I have a beautiful 5-year-old boy that I tandem fed. He was exclusively fed breast milk from myself from nursing, and also shared milk, donor milk, in form of milk sharing. So that's how he was exclusively fed until he was 11 months. And I am so glad to be here with you guys.
Hey. And last but not least, Miss Tameka.
Good afternoon. My name is Tameka White. I am in Benton Harbor, Michigan. I am a certified lactation specialist, postpartum and birth doula, and also mom of 3 breastfed children, currently nursing an almost 1-year-old and almost 3-year-old. What else is there? Oh, what do I do? So I am the founder of an organization called Lact Power. It's all about lactation and empowerment. We also offer birth services, postpartum services, and advocacy.
Thank you. Thank you all for those wonderful introductions. And right now we'll have Bonita go over a brief history of Black Breastfeeding Week.
First, it is super, again, great to be in the space with all these supporters of breast chest feeding. So glad to be with you today. But just a little bit about Black Breastfeeding Week. We are in its 11th year. So like that's saying something, right? It's certainly relevant. We're in its 11th year. We are celebrating on day 4 today. But the week was actually established after National Breastfeeding Month and after World Breastfeeding Week, with an emphasis that someone needs to say something about the experience of being Black in the United States of America around our breast and chest feeding choices, right? So there were 5 top reasons that were created and highlighted by 3 Black women who are breastfeeding champions. So Kimberly Stills Allers, author and journalist, Anaya Sangodeli Ayoka, who is a nurse midwife, and Kadada Green, who is the founder of Black Mothers Breastfeeding Association here in Michigan. They thought to raise awareness around what we know, and hopefully our participants today will understand that there is a high number of Black babies dying in the United States of America. So the high infant mortality rate among Black babies. And then also taking a look at the high rates of diet-related disease among Black children. We're talking about type 2 diabetes, asthma, upper respiratory infection, and even childhood obesity. So we need to center our conversations around what's happening around our Black children. The lack of diversity that is not present in the lactation field, right? So lactation professionals of color, specifically Black women, as we kind of carry this conversation today. And then those unique cultural barriers that are experienced by Black women who are making that choice to provide human milk to their children in the United States of America. And then also, while we're asking Black women and Black families to breastfeed, chest feed, provide human milk, we cannot not acknowledge the lack of support in our community. So those are really the top 5 reasons why the week was established. But we also want to say that it is a week to celebrate, to affirm, to amplify voices, and just to support the Black family's choice to provide human milk to families. So Lyann, with that, I'll turn it back over to you. Oh, yes. Actually, it's still me, right?
Yes, for you. So we're going to jump into our questions now. Yes.
Awesome. Let me just go ahead and pull those up on my phone because, you know, computers are really interesting today. I just want to make sure I have a second device. So here we go. We have a series of several questions, and we've asked each of you to respond to the questions. I'm going to ask you question number 1, and this question will be for Rita, and it will be for Kiara, okay? In your experience, what are some of the biggest challenges that Black birthing people face when it comes to breast chest feeding?
I guess I'll start off. I'll say 2 things. Just support. Support in general. I think hospital and health systems have realized that lactation support is important to have on birth and delivery for us. But what we're often missing is that support that is representative of the population that they serve. so that there is that comfort level of being able to be served by somebody that looks like you or supported by someone that looks like you in the time of the birthing experience. That also decreases the level of implicit bias that just we know exists in the medical community, the lack of sensitivity when it comes to the needs of Black people in general, and the birthing experience. So I'm definitely going to say more lactation providers of color in health systems. I will also say that one of the barriers that a lot of health systems, including our own, has is that a lot of positions that are posted for lactation support in health systems require a registered nursing degree. And the two are not mutually exclusive. Infant feeding and registered nursing are two different fields, and people can be professionals and subject matter experts in lactation without being registered nurses. So that is definitely an equity barrier that we need to pull down. The second thing I will say, and I'll say it very quickly, is that infant feeding decisions need to be a part of the entire perinatal experience. We need to get out of the habit of waiting until 2 weeks before delivery to say, oh, do you know how you're going to feed the baby? Those conversations and that education and that support should start from as soon as that parent finds out that they're pregnant. And it should continue not only in the office, but in the home, so that there is full education on, and allowing that person to make that decision in regards to infant feeding.
Thank you. Kiara?
Yes, thank you. I would also add, in relation to education, that information about chest feeding and breastfeeding isn't made available as early as it should be. Oftentimes those conversations aren't being had until later within the pregnancy. And we see that there is a great need to present this information earlier on, as we start to talk about reproductive health and sex education. Breastfeeding and chest feeding should be a part of those conversations so that folks have access to that information. I think also, in relation to challenges that I've seen working with families, is just stress and mental health is a really large component when we talk about the duration and people's choice to decide to feed their babies. We know that Black women in particular have a very long history with stress, and we know that more needs to be done about addressing stress levels and mental health. So we need to make sure that we're also addressing that. And the last challenge that I would say is related to workplace challenges in particular. We know that when we invest in lactation and when we invest in making sure that families have access to longer leaves, that they have access to leave in general, when we create policies and spaces and places for people to breastfeed or chest feed their babies, we know that we see a return on that investment. So we need to be intentional about creating an infrastructure that supports our parents, but that also supports our lactation folks that are helping in community to see those challenges really be addressed.
Thank you. All pertinent and relevant information, and information that is necessary for this discourse, right? And so let's move on to our second question. And this question will be for Tameka and then again, Rita. Can you talk about any cultural stigmas or misunderstandings about the Black community that may present as barriers to breast chest feeding?
Yes, thank you for that question, Bonita. So it's very nuanced, and we cannot talk about Black breastfeeding without going back to the socio-historical context of the transatlantic slave trade and the African people who are affected by it. And that's not only US, right? Because there were African bodies dropped off at different places, and we all are affected by the interruption, because ancestrally African people breastfed, right? some of the stigmas around breastfeeding that also stem from enslavement is that African women were both oppressed when it came to breastfeeding, as in the wet nurse and having to provide her milk for white babies, and also being blamed for her own children not thriving. Like, how how can you forget the context that you are enslaving me, you know, and I don't have the power to feed my own children, and then also, you know, allow your children to get fat off my body, right? And then that lends itself to the stereotype. And when I look at cultural misunderstandings, I would say that we as Black people with the intergenerational trauma from slavery have cultural misunderstandings. But also, and also that there were intentional cultural misinformation. And so with that, there's the trope of this mammy who is an oppressed woman, right? She's an oppressed woman and she's being forced to feed other babies. But the stereotype and the trope of this mammy is that she's jovial, she's happy, she has a loving, soft hand in the care of these white babies, but yet she has no particular affinity towards her own children. And in today's culture, that also lends itself to the stereotype of the welfare queen, right? And this person who's not tending to her children. And also that lends itself to the cessation of breastfeeding early because it's not going right and you don't have the help and your child is losing weight, and there's the fear that you're going to be blamed when, you know, you never really had what you needed from the beginning. And also, I would say, because of chattel slavery, we were taught that our bodies, we were dehumanized, right? And so we were taught that our bodies were nasty, dirty, and we were over-sexualized. And that lends itself to thoughts of, we'll go past that, but that lends itself to, like, why would I want to put this nasty, dirty thing in my baby's mouth? Because we may not have remembrance of the trauma, but we are still impacted by it. And so it's like, why would I put this dirty thing in my baby's mouth? And then intentional misinformation taught us that we were dirty, formula is superior. And so there's the stigma there that formula is better anyway. It's loaded, and like we would not do the topic justice in the little bit of time we have. But I could talk about it all day, but I'm going to try to see if there's anything pointed that I want to say. Also, our body were commodified, right? And then just a little point about the suppression of lactation for African women is that her lactation was suppressed in the interest of capitalism. And today, how that relates is a lot of us are being forced to suppress our lactation in the interest of capitalism.
Thank you, Tameka, for that. I think we can't talk about the history enough, first and foremost. And what I will add to all of that beautiful context that you gave is the awareness of the current Black community that's why we don't see our peers breastfeeding at the rates that other communities do. The awareness that your mother and grandmother didn't breastfeed because of that. Like, my grandmother's mother was a slave. So she did not breastfeed. It was just not handed down. It was not something that we saw. So we're growing up in households mostly, I'm not going to say everyone, where we're not seeing this. So we have to make a conscious effort as a generation, as a community, to try to change that imagery, so that our children will see, our infant feeding decisions. I will also say that the Black community tends to want to cover up. So anything that would expose your body is not appropriate for you to be doing. I can't tell you how many times where this picture right here of me shook some of my family members up. Like, you posted that on social media? Or being out somewhere and trying to breastfeed, and my own family be like, here, take this, cover up. And I'm like, I'm okay. That's what these were made for, So I think that there's that context. And we also talk about like the cultural norm of, well, my mama did it. Pet milk was fine for me and I'm okay. And formula was fine for me and I'm okay. But we're not, because we're overweight and we have diabetes and we have all of these things that are piling onto us because there are these particles that are just sitting in our gut that have been there since infancy because they were not meant to be there. So just getting out of that idea of like, yeah, get our baby cereal. I started doing cereal on my baby when I was 3 months old. Like, those are things where we need to learn better and do better. And culturally, we're just not great at that. So it really takes that like relearning, like, okay, well, let me break down to you why this is the decision, why, we're encouraging you to make. So I definitely think that all of that really, really plays a role in the cultural stigmas.
That was such an in-depth, in such a short amount of time, relevant historical framework of why we are here today. I just want to add one thing. Before we were stolen from our continent, our ancestors, it was a cultural norm, right? So it was something that we did. It was not uncommon for even siblings of age 6 or 7 to continue to be breastfed, to continue to receive the sustenance that our bodies produce for our own children. And so I just wanted to kind of give that as a baseline. We come from it, right? Mm-hmm. So, and it was taken from us. And we were made to provide something that we couldn't provide our children, to an infant who was going to grow up one day and call us their slave.
Bonita, can I add just one more thing also?
Yes, you can.
I also want to say that I feel like systemically, Black women, Black parents, Black mothers have been the person that has to do everything. I have to go to work. I have to cook the meal. I have to educate the children. I don't have time to be carrying this baby around on me all of the time. So, we're leaving the home to provide for here and there. And there's so many different, systemic issues that may have caused that sort of structure in our community. But nonetheless, it's like when you go to work and you're dealing with the stress of work, now you got to fight with your boss about, can you pump, or where can you pump, and can you have the time to pump? And that reduces milk supply. And it just, it gets overwhelming and it gets to be too much. And I think anybody can understand that. So this is kind of like a cross between our cultural stigmas and our systemic barriers, because we have all of these different responsibilities that we have to make, and the systems don't make it easy for us to navigate those and still be present with our children.
Thank you for that, Rita. I really appreciate that. So my question is going to go to Audrianna, Reggie, and Jazz. So I want you to answer, how can healthcare providers and lactation consultants better support Black parents who want to breast or chest feed?
I can go first, or we can go first. I would say in terms of support, because like a lot of times like doulas get involved like well within like pre-birth or that time frame. The best way to support is just honestly like providing those education resources in terms of, I feel like I knew a lot of things about like how to get my baby to latch, what I should be looking for in terms of the latch, but I feel like a lot of times the focus gets so latch focused that a lot of times the education that's missed is, okay, what's happening when my baby's not getting enough calories or when my baby's not getting full, but they're eating all the time. And like those things, like those are things that I'm now second child year into breastfeeding her. I'm still learning about her because I didn't have that issue with my son. And so I think like in terms of support, just having that extra layer of education that isn't just about how to properly breastfeed, but the signs to look for when they're not getting enough milk or their milk isn't enough or it doesn't seem like it's enough for them, and kind of like what that looks like, and then how to approach building up not only your supply, but enough caloric attributes in the milk to provide what the baby is really needing.
Mm-hmm.
Yeah, I would definitely add to that of that education even within themselves, because if they don't know, then how are they going to help us? And because they're being fed this one note type of education about this is how you latch, this is how you do this is how, oh, you didn't do it, okay, cool, formula, right? Like they need to understand that there's nuances in there, and also educating around like when your milk comes in, and that a lot of folks milk doesn't come in as soon as you pop a baby out, and within like my milk didn't come in for I think like 5 days, and they were pushing. Oh, well, can't chest feed. Here's your formula, whatever. And I was like, no, we're going to keep this up. What can we do? How can we have this, yeah, I want my baby to eat, of course. And so if we got to do that until my milk comes in, but as soon as my milk comes in, I'm done with that. But for them, it was like one or the other. It was like, oh, your milk didn't come in immediately, so this baby's going to be formula fed the rest of their life, and I was like, wait, no. And so I think being able to educate themselves too around, how to have conversations and listen. I mean, honestly, the biggest thing is a lot of times people are advocating for themselves, but because these providers sometimes get into the one note thinking, they're not listening to the parent. Like I was truly blessed in that one of my lactation specialists in the hospital was an African. And so she was trying all sorts of things. I couldn't even tell you half the shit she was putting on me in order to get my milk to come in, in order to she said, no, we're going to feed this baby. Clearly. But I think part of that too, to, what Audrianna was saying too, of like also feeding us. Sometimes we get so focused on we gotta feed the baby, we gotta do this. Well, the baby not gonna get no milk if you're not drinking water, or if you're not if you're not eating good as well and getting your proteins and getting your whatever. And so I think having a specialist be able to educate us about all of that, it's not just did your milk come in, okay, baby's eating, right? Like, if you're not eating well, that baby's not eating well, so even if the baby is latching, but you're still eating, or you're only eating once a day because you're so tired, and and that's fair, right? We were all there. Right? But if you're only eating once a day and you're forgetting to drink something, even if it's not water, just drink something, right? You got to keep those fluids up, keep that stuff, right? Like being able to educate about the holistic approach to chest feeding and breastfeeding, like that's where we really need to do better at, is that holistic approach, because it doesn't matter how well your milk comes in if you're not eating, or if that baby, whatever, we got to make sure we're keeping it holistic.
Can I speak to a point that actually made me think about?
Absolutely.
Also, like having the partner education increased because I feel like a lot of times, and I don't know if this is just like my experience, I think it just like parents in general, like birthing parents in general, go through this, oh, well, like we did the research and we're being told, or we're, getting suggestions from our providers, but it's almost like because of like these instilled ideals or like cultural changes that were made or like done to us, it's like, oh no, you need to feed them cereal, or well, like, okay, they may tell you that, but they're just telling you that, or like making sure like our support system around us understands that like these are things that were not normal, that are not normal to push formula or like just completely try to like oust breastfeeding, but also like how those standards are changing with when you introduce cereal or introducing cereal at all in milk, and also just how to support us. Because I think that is one thing that like we have found is that like I have to teach him how to be supportive of me while everyone around us is telling us that we're doing it the wrong way. And that it just becomes a huge stressor. And I think that would be a huge thing that would take a weight off of us as like the birthing parents, is like in encouraging that education of our partners and of like our support, like our immediate support people, so that they understand that like there are a lot of new norms that are just reinforcing our old culture.
Thank you, guys.
I agree with that. I think that being able to have, even if it's not your partner or, whoever, right? Like having that support system, especially right after birth, right? Because I don't know about y'all, but I wasn't in my right mind. And so having my partner be there to say, no, this is what Jazz wants, because there were times that, again, I'm tired, right? I'm struggling. I want to sleep. And so, they're just like, oh, I'll get a baby formula, right? Like, and I'm like in my tired brain, my brain is just like, you mean I don't have to be tired? Right. And my partner's like, no, that's not what we said we wanted, right? Like we want to make sure that we're, chest feeding as much as we can, and we can supplement if we need to for now, but we're going to do, so making sure that our support system also is there to know what we want, which then goes back to a point that was made beforehand in a previous question of we got to be having this conversation before we're on the, birthing table. Like this has to be a conversation that is happening throughout the pregnancy, so that when you get there, you're set. You already know what you want. You already know what you need. You're not trying to push through the drug-induced brain to try to figure out where you're at.
Right. Thank you, guys. Okay, so my next question is again to Audrianna, but it's also to Tameka. Can you speak to any pivotal moments or experiences that influence your decision to breastfeed? And Audrianna, you can go first since you.
I would say like it was kind of honestly when I was a kid. I always wanted to be a parent growing up. So like I always thought breastfeeding was like so cool. But I think a huge portion of that, seeing that growing up for me, is like because I'm mixed, like my white family, like they breastfed, whereas like my Black family didn't. And because I was predominantly, more exposed to white mothers when I was younger and growing up, that cultural shift and difference was a different perspective for me. But that being said, like I think that influenced me a lot because the people I looked up to a lot breastfed, and breastfeeding was super important to them. And therefore breastfeeding was kind of like really cool and important to me. But I will say like I was never discouraged. And I think that pivotal moments in my adulthood that like reinforced and encouraged me was the fact of the bond that I noticed I was getting from my child. Because I know a lot of people, or at least in my experience, I have noticed like as soon as my child hits like 6 months old, they're like, okay, when are you done?
Mm-hmm.
And I'm like, well, I don't know, probably no time soon. So for me, I think it's those moments that are like pivotal moments for me where I'm like, I'm encouraged to keep going, but it also makes me question like, why is there such this push to break that bond from mother to child?
Mm-hmm.
Yeah, I say like her, I always wanted to be a mom. Even in elementary, other people wanted to be firemen and nurses and doctors, and I just wanted to be a mom. And I could think of a couple things. One, my mother was denied the right to breastfeed. She was in an area with limited access. She was also only 13 years old. And for whatever reason, my brother got sick and she was told that her milk made him sick. And just something in me knew that that was not right. And the retelling of this story in our family, even as a child, I knew that that does not sound right. Before I got pregnant, maybe 6 months before I got pregnant, I saw a friend suppressing lactation with the ACE bandage. And I was so afraid of that, that I was just like, she was hunched over in pain. And when I saw that, I was like, you know what, I would rather breastfeed, you know. And then I had a home visiting nurse that taught me about the benefits of breastfeeding, both the health and also the emotional aspects. And so with the three of those things, I was just like, the day came when the nurse asked, how will you feed? And I was like, I'm a breastfeed. And so I told the father of my child, and he's like, what made you decide that? And I'm just like, it really wasn't a contemplation, you know. I received information, you know.
Absolutely. I want to highlight a few comments. Denise talked about how access to affordable, healthy food options, safe, affordable housing, transportation are very important. And Brittany said, it seems like all the providers are giving different suggestions and parents are just not sure which advice to take, even among the lactation consulting community. And I think that's also true. Just having like a standard of care, right? We need to figure out what that standard of care is so that we're giving the correct and best information to everyone that we're coming into contact with is very important in establishing healthy lactation relationships. Trying to think, I just saw a couple more before we continue on. Kiara, I'm sorry. We have to have conversations even during the preconception period about our options and choices. And you're correct. We do. Like, we need to know, like, what our choices are, what are our options during preconception, during pregnancy, so that we're not trying to figure it out last minute after we've had a baby, been in labor for hours. Trying to think. So yeah, absolutely, Brittany. True family planning, right?
Hey, this question, let me just frame it by asking those of you who will respond to think about your own individual communities. What I appreciate about this conversation is this is a cross-community panel. So we have representation from Benton Harbor, here in Grand Rapids, as well as in Detroit. So by asking this question, again, think about how this applies to your specific community. And this question will be for Rita, Tameka, Jazz, and Rachel. Rita, Tameka, Jazz, and Rachel. And here's my question. In your opinion, what resources, and we kind of touched on this, but kind of let's unpack it per your community. What resources or support systems do you find in your community that are particularly helpful for Black parents who are considering breast chest feeding?
I'll start, I guess, because my name was first. So I will talk about several different organizations that all uplift and support breastfeeding. I work very closely with Black Mothers Breastfeeding Association. I'm also a mommy ambassador for that group. So I have been an outward representation of that organization for the past 4.5 years. And there are just so many different ways that BEMFA is trying to expand breastfeeding support, care, education, doula support, training our leaders that are in like obstetric and gynecological care to be sensitive to the needs of Black folks in the birthing experience. I want to uplift Southeast Michigan IBCLCs of color, where we talk about there not being enough representation in the field of lactation. They've come together as a group to say, we're here, we're Black, we're educated, but also trying to find spaces where, even the, parents who would like to have access to their services can have access to them without having to be private pay. So let's fix those support systems so that those IBCLCs can get the coverage that they need, regardless of the, status of their clients. I want to talk about Birth Detroit, who is just, I learned so much more about them recently at BEMFA conference, and I've always known about their existence and their presence, but to actually hear families who have been under their care speak about just how pivotal and life-changing it was to come out of systems where they weren't heard, where they weren't listened to, where their visits were 10 or 15 minutes. They never got to know their providers, and to come into a space that says, here, bring your babies. They can play over here while you're getting checked out. What do you need? Can we get you a ride here? Do you have food at home? The real, like Jazz was speaking about earlier, that whole picture, that holistic care. And they're building a new state-of-the-art facility. It is completely Black owned and Black ran. The first birth center in the city of Detroit, the first Black owned center in the state of Michigan. It's just incredible work happening. So shout out to all of those organizations and the work that they do for the community.
I can go.
Go ahead.
And I do want to say before speaking, Rita, I was at that conference and that's where I first saw you. And just going to BEMFA's actual office, I started crying. Kidada was like, okay, woo, woo, woo. Because seeing a school, it was a school, but a decommissioned school, but just offices for Black people, medicines for Black people. You get a Black face every time you walk in that building. There's rooms for Black people to talk about the things that affect us. But anyway, I would say that for Grand Rapids, the breastfeeding task force with Corewell Health encompasses local programming and community leaders. And I think that is really setting the tone for care and equity within the biggest hospital in the city. Just making a reference to, again, it's full of Black and brown people who have the experience, the education, the certification, and just a voice to say, what can we do different here? And while that might not always be seen by families immediately, I think that there is so much that can and is being done from within that space, especially for Black and brown families. Birth outcomes are being discussed on a monthly basis. Think about that. Conversations are being had and people's experiences are being lifted up and reconsidered every 30 days. And I would like to add in that would be from written feedback, because that's important, right? Don't cower, don't be broken, don't be silent. It's important for people to get feedback about your experiences because they do matter. And I think that's really impactful and groundbreaking for it to be in Grand Rapids.
Yeah.
In Benton Harbor, we have a few programs or organizations that support breastfeeding in general, and are also an excellent resource for Black families. And I also find them to be complementary to the work that I do, because if I'm seeing a mom who is also in one of those programs, they're hearing, kind of the same information, at least the same encouragement to breastfeed, and then fact-based information. And those programs would be Nurse Family Partnership. I am a product of Nurse Family Partnership. They provide home visiting nurses, and they give evidence-based information on birth and breastfeeding. And then they also provide emotional support. And I remember in my experience of being pregnant, I really needed that person to come sit beside me and talk to me. And so I didn't feel so lonely, because your life changes, especially if it's not a planned pregnancy. Also, I would like to uplift WIC. They have been a very good partner with the community to provide breastfeeding support, and also in providing peer counselors, which I am a product of WIC as a peer counselor, and training peer counselors, that reflect the community in which they serve, and prioritizing, that the person is reflective of the community. I think it's really important and helps to impact the breastfeeding initiation and exclusivity in our county. Another would be Present Pillars, who is not breastfeeding specific, but they address fatherhood issues, and they educate fathers on how to support lactating mothers. And so that's really important. And also in the co-parenting aspect of relationships, all of those things can impact breastfeeding, right? And so I really, really hope to work more closely with Present Pillars. And then coming down the pike, we have doula training through the advocacy of the good sister Bianca Nash Mio. And she saw a need in this community, and she advocated for a doula training to be hosted here by Common Sense Childbirth. And so I just am excited to see an influx of breastfeeding and birth workers in this area, because our families need it. And not only do they need it, they deserve it. Also, Lact Power. I am grateful that the desire was placed in my heart to serve the community. And so I enjoy what I'm doing with breastfeeding and birthing families, and also connecting them to other resources, like, for instance, the Community Health and Wellness Center by Corewell, which addresses needs for families, emotional support, health support by doing testing, like your blood pressure, test you to see if you're a diabetic. They also provide emotional support by having a clergy person that could talk to you. Also, diapers, wipes, Desitin, all of these, needs can be met within the community. And so that addresses financial issues. It may be, I can't help a person with a breastfeeding problem, and they need to see somebody, higher scope. They can save money by going to get the free diapers, and then they can pay the IBCLC. And so it's just really great to have community partners that we can work in tandem with to help Black breastfeeding families.
I mean, ditto. But I will say, I will also shout out Day One Doula Collective, since I feel like that's kind of an opportunity that got missed there for Grand Rapids. So, I'm all for programs and services that are for us by us, because that's really how we're going to address a lot of these things and start to address the stereotypes and address the need for resources. And but it's not just resources. We need cultural competent and cultural humility resources that are understanding and can reach the people and be able to address these concerns that we've all brought up and talked about, and but also have some layer of trust there, right? Because it's I mean, I even experienced it, right? Like I had a much better experience with my Black lactation specialist than I did the white one. It wasn't anything necessarily wrong that the white one did. It was just I trusted the Black one more. So I think, that's what I love too about like day one is it's us teaching us.
And I want to just jump in there really quickly. And Jazz, if you hadn't said it, I certainly was going to bring it up. So we are appreciative in our community to have a Day One Doula Collective, to have Bump to Birth Doula, to have Lyann, More to Love Doula. I would be remiss if I didn't mention our own Strong Beginnings family.
I was going to say.
Our community health workers who are peer counselors, lactation specialists, birth educators, or lactation counselors. And there are, what I can appreciate, I've been in maternal infant health working for Strong Beginnings for almost 20 years. And so as someone who can look over the landscape of the community, I am extremely proud to see how our communities of color are offering these wonderful services for our Black families. My own really birthing experience, there wasn't any, right? So for me to see all these wonderful support for our Black families, it just warms my heart. So I just wanted to kind of jump in there and share that as well. And then I'll just leave it over to you, Lyann.
Yes. So, real quick, this next question, I do want to say, because Rita, you did not share it with everybody. She is also another resource in the Detroit area to help with lactation care and support. But question number 6 is going out to Rachel and Kiara. Just looking forward, what changes do you hope to see in the field of lactation support and chest feeding for Black parents?
Thanks, Rachel. There's a few things when I think about some of the changes that I would like to see. One, just advocating for more workplace policies that really address centering the families, whether it's longer parental leave, offering flexible hours, really being intentional about having dedicated lactation spaces. I know we continue to have conversations in community about facilities having a dedicated workspace. And in particular, I think about some of our workforce that are working in the fast food areas. Like, where do we place a lactation space in some of those buildings and facilities? Like, how are we making it comfortable for our families who are lactating in those spaces? One other thing, when I think about some of the changes that I want to see, is just inclusiveness, both with language and imagery, and knowing that there's a lack, and there has historically been a lack. When I think about inclusiveness, particularly for our up-and-coming care providers, we know that there is a lack of representation within the literature for our folks who are being educated in healthcare. I wanted to quick plug one of the most amazing things that I've seen in the development of making sure that there are inclusive images is the Melanated Mammary Atlas. It is an amazing resource that really just highlights the fact that the way like mastitis would present on melanated skin in comparison to fairer skin, you can use that atlas to really address some of those issues, and knowing that. So big shout out to those that were leading that initiative, as well as the folks who are submitting images for the atlas. I think that's a beautiful aspect of that work, is that it is community driven, and that community can submit those photos to help really spread the word about this. But I'll drop the link in the chat for you all. But those would be the two things that I would really love to see in relation to some of the changes.
Thank you.
I have one, and I love that I wrote this answer before we had this conversation because I get to piggyback off of every single person here. So I said that I hope to see cohesion amongst providers. We know there's kind of a hierarchy which needs to be torn down. I think that everybody has a place, and I think that we can all be helpful in our different capacities. And I want there to be sort of a reaching in to help Black parents understand that they have the skills and the support within their communities to breastfeed. I want to hold them in a little closer so that we can get Black parents comfortable with their history and their bodies. See how we went back? Yeah. So, so just understanding the history of their bodies and how that relates to what they may be experiencing. I think that is more than anatomy and knowing what tissues do. It's about understanding how we got to feeling this way about our about this beautiful process in the first place. And we talked about like your grandma and your great grandma. We know they didn't breastfeed, but I kind of want to touch on it. I think the young lady's name is Christina. When we went to the BIMFA conference, they spoke about this, and I want to say this out loud so that you can understand that certain things didn't start with you, and it's okay if it's hard, but don't stop because it's not it didn't start with you. It comes from generations. They said 2,048 people had to give birth in the last 12 generations for you to be here. 2,048 people. That's a lot in your genes that had nothing to do with you. And I think that knowing this could allow us as a community to give ourselves grace as we take the journey to normalizing chest feeding.
Thank you. So my last question that I have, and I'm just gonna pick two people. Yeah.
I'm sorry. Can I interrupt you? I know I wasn't on that last question, but
please go ahead.
I want to add in just more research and education for the field on the differences in people's body. I would not be myself if I didn't advocate for post-surgical moms or moms who've experienced breast surgery, because I felt like every time I sat in front of a lactation professional, whether Black or otherwise, it was like they were in uncharted waters trying to deal with me and my reduced breast size and like what the impact that had on my ability to breastfeed. And I don't think that that's any particular person's fault, but I think that there should be more research and education, on the science behind the differences in post-surgical breasts, and also just learning from the experiences, because I personally feel like I now have a wealth of knowledge that I could use to better support someone else who is post-surgical and thinks that they can't breastfeed at all, and letting them know that it's still possible and what the options are if there are any challenges.
Thank you for adding that, Rita. I agree completely. So I'll probably ask this question to, let's see, I'm trying to think of my folks. Jazz and Rachel, just this last question. How can having birth workers of color impact the racial disparities in lactation? And I want to hear from you guys. Jazz, I know you touched on it a little bit, so maybe just elaborate a little bit more how you were feeling.
Can you ask the question one more time?
How can having birth workers like doulas, midwives, OBs, lactation counselors of color impact racial disparities in lactation?
Mm-hmm. Yeah, I definitely think that, having people that can understand even a little bit of what we've discussed today, right? Like understand the history, understand the systemic portion of it, understand the generational trauma, understand even just a little bit, like obviously we all have different experiences, but we all do share those general experiences. And so having someone that can understand that, and then on top of that, hopefully be culturally competent enough to be able to work with different people and work through some of those things and work through that, whatever barriers are in place for someone to be able to have a fulfilling, long chest feeding journey is super crucial to being able to have that, and then have that support, have that person that, there were times that I literally would call my doula, 3 o'clock in the morning, like, I can't do this, I'm done, F it, right? And like have them be able to talk me through. Apparently my child is now found me. But being able to talk me through that, being able to, understand like why I was frustrated, and and dealing with like, okay, now I got to do this at work. How am I supposed to do that? Now I got to, whatever. And being able to have someone in a community, especially that wasn't my family, that, every 2 seconds was like, you done yet? You done yet? Right. Was super, super crucial to understanding. And then for me in particular, being trans, also having that piece of understanding and being able to use that inclusive language, being able to understand where I was coming from and the struggles that I was having. Kind of a catch-22 for me, being able to activate a space in my body that I tend to not want to activate. And so being able to talk me through those struggles as well, so we kind of talked a little bit about how, historically Black folks have been told that we're, nasty and stuff like that. But then for me as a trans person to also have this weird relationship with my chest, but yet it is very life-giving to my child, but not life-giving to me, was a definitely interesting kind of conundrum that I had to go through during my journey. So to have that cultural competency piece, to have a doula and a lactation specialist and a whole team behind me that understood those needs was super crucial, that I do not think I could have got from anyone else.
Thank you for sharing that. I appreciate that.
I would say, as a community health worker who is also the only Black person on my team, I would say having representation allows for the mask to drop. As a Black person, when I walk into a space and they say, "How are you?" and I say, "I'm good," people will just walk past you and take your "I'm good" for "I'm good." Mm-hmm. Whereas somebody who lives your experience, that "I'm good" could mean a plethora of things. And you may be just waiting for that one person to say, "You need help," or to say, "I see you, I hear you." I love how we all hopped on and said that as soon as we got on. And because of that, you're not only doing the thing, you're building rapport. So those little itty bitty scoops of trust, they're accumulating. So in the times that I have to be a little harder on someone, they take it because they know it's love, and they know that I don't mean anything by it, and that I care. And it's because I care that I can be here for you like I'm being here for you. And I know that you can handle it. And just creating space. I call creating space this box. If the box was shrinking, my hands go up like this. I'm going to teach you to hold your hands up too. It's not my job to hold the hands up all the time. I have to take mine down and allow you to do that. And I think that only someone who shares your experience can give that to you, and you feel safe and it feels genuine.
Thank you. Thank you so much. I did want to highlight one question I saw from Denise, and she asked, are we all familiar with the work of Dr. Karen A. Scott from Birthing Cultural Rigors, and how are we engaging in her work in West Michigan? I'm assuming that's what that was trying to say. I'm not familiar yet, but now that I have that name, I will get myself acquainted. Are there any other questions that we can do really quickly for our panelists? I'm looking at the bottom. It's a lot of thank yous. Thank yous. And check the Q&A. Oh, the Kellogg. She works with the Kellogg Foundation. Thank you.
don't think we have any additional questions. I don't see any in the chat, but what I would love to offer is in our last remaining minutes, we have about 8 minutes, and then we would invite you to also complete the evaluation. So Kendall, why don't you go ahead and put that in the chat for those who might not be able to remain for the last 8 minutes.
Mhm.
But are there any of you panelists who would like to provide a last thought regarding the discussion today? Anything that we kind of maybe didn't touch on that you could provide a last thought for our participants and guests today? I'll just quickly say, Rita, that image in the back, I'm just loving it. I'm just all smiles.
Yeah.
I will say that in Kent County, look for the billboards for from Strong Beginnings. We have lots of billboards going up during this week that you can see Lyanna and some friends, and just some images, beautiful images of Black women enjoying the experience of breast chest feeding.
Can I just plug milk donation? I would never encourage any parent to induce an oversupply, but if you just so happen to have one, I really encourage milk donation. It made all of the difference for being able to keep my son fed and healthy because I was unable to exclusively provide him with the milk that he needed. And you just never know, your neighbor, your family member, your friend, if they're having struggles that they don't have control over, but would still like to offer human milk to their babies, because human milk is not accessible from a milk bank. It can cost up to $5 an ounce. And when your child needs upwards of 30 ounces a day, that can be really expensive and unattainable for most. So I'm always going to advocate for milk donation and milk sharing in situations where it's appropriate.
I would also like to add, I don't think that I believe in putting things in simple terms so that it's easy to digest. You are a new person when your baby is born. Your baby is now experiencing the world that they were never a part of before you gave birth to them. Give yourself the time to learn each other. Give yourself the space to understand their patterns, understand what they're experiencing. And I always make a reference to, imagine your neck is itching and somebody always puts a pacifier in your mouth. Imagine you could be itching, feeling all types of things, but just being kind to yourself, being kind to your infant, and being kind to your circumstance will allow you to, I guess you could say, for a lack of a better word, endure a little longer.
Thank you, everyone. I appreciate you all being here today. Thank you to our panelists for contributing your time, your voices, your opinions. I appreciate each and every one of you for this today. You all did amazing. I am so appreciative of all of you so much. So yes, with that being said, if there are no other final thoughts, I will give you the grace of 4 minutes